the years, MS TeamWorks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
I'm Dr. Jennifer Graves from University of California, San Diego. I'm an MS specialist, neuro-ophthalmologist, and MS researcher. I take care of both adults and children living with multiple sclerosis and help bring them access to exciting research protocols, as well as put together comprehensive care teams to take care of patients and their families. Developing trust and a successful working relationship between providers and patients is critical to the management of multiple sclerosis. We try to put together teams of individuals, including physicians, nurses, pharmacists, and other support staff, so that we can take care of all of the needs of people living with multiple sclerosis. And it's very important to develop good working relationships and coming from a place of trust and respect for all involved in the care management team, including patients, their partners, their children, other members of the family. Often a good place to start with establishing trust is trying to understand where the other person is coming from. For people living with MS, MS affects folks from all walks of life, all backgrounds. And it's important to understand where people are coming from, what their current understanding is. And it often begins with a very simple question in a new patient visit, which is, what do you understand about your MS? Where are you in your journey? And how can I best jump in at this time point to help you with your story and your journey with multiple sclerosis? Some key elements for developing good relationships and trust between patients and the care team is to be flexible and to have lots of modalities of communication and making sure you can meet the patient where they are with their multiple sclerosis and the easiest modes of communication for them. At our center, we have ways to contact patients through email, secure emails afforded by the electronic health record, as well as a clear system for managing phone calls for patients, so that depending on their comfort level, we can speak to them through the modality that is easiest for them. When patients are there with us in clinic, it's important to look at the environment of having the important conversations with patients. If there is a language barrier, always making sure there's a high quality interpreter available so you can speak with patients in their language and in a way that's comfortable for them. If there are family members who speak a different language, making sure that their needs are met as well, so that everybody can ask questions and feel like they're being heard in the process of taking care of multiple sclerosis. It's also important to try to reach and communicate in ways that are clear, and stopping and asking if patients have questions rather than getting through a 40-minute visit and waiting to see if they have questions at the end. Continually stopping and making sure you're connecting with the patient and the families, and that they don't have questions as the visit continues. The patient's voice is absolutely critical in establishing a good care relationship between provider, patients, and families. While I think it's very important as MS specialists, we share our expertise, our intellectual and research knowledge about the disease, there's lots of room for making decisions that fit for that individual patient in front of you. Some of the things I try to understand about individual patients is their risk tolerance and what types of side effects they're more likely to be able to get through in terms of MS medications. It's also important to consider their occupation, certain aspects of their lifestyle, transportation needs, family responsibilities, to see what types of management plans will work better for that patient. And it's also important to hear what their concerns are and their preferences are and answer their questions about current MS research as we try to put together a management plan that works best for them, that they'll feel comfortable adhering to, and that they feel they were a part of creating. I can think of one key example of where individualizing care and engaging the patient in their management plan changed the course of management for someone living with multiple sclerosis. A young woman came to us after her first attack of multiple sclerosis, but she had had a lot happen in her life, even at her young age, even before the diagnosis of MS, including, unfortunately, episode of trauma and battle with substance abuse, as well as battles with mental health. And a key factor for her being able to treat her MS was our entire care team, from nursing to administration, to the physicians, to the trainees who held the pagers, being willing to talk with this patient and understand why she was fearful of starting disease-modifying therapy and why she was fearful of trusting the healthcare environment. So it was absolutely paramount for us to come to the patient at her level and her understanding of multiple sclerosis and work with her to build the trust and allow us to provide therapy. And she's done beautifully since and has been able to control her disease as well as improve her other medical and mental health illnesses. So fostering that relationship and fostering it across the entire care team to understand where she was coming from and what her story, what her journey had been, not only with MS, but with the healthcare system, made a big difference. So one thing that may be overlooked when developing care programs for people living with MS is the need to develop trust and strong relationships among your care providers and your healthcare team. One thing that we've come to do in the age of electronic health records, where a lot of people are corresponding by email and electronics, is to actually set times during the week to huddle together, to discuss complicated patients, to support each other, and to foster trust and compassion amongst the care team, which will then overflow into more trust and compassion towards the patient. So we do once or twice a week team huddles to discuss how we can better care for patients and to ensure that we are co-managing patients together as a team of pharmacists, nurses, MS providers, and trainees, and it helps us be there for patients. I think the key points to take away from developing a care team built on trust is communication and the willingness and empathy and compassion to understand each other, to ask the patient where they are in their MS journey when you're engaging them and developing their care plans, to work with your own team and all members of your team, from the people who check patients in to the nursing staff to the trainees, to help them to understand the importance of trust, communication, and developing a sense of co-partnership in the management of the disease. It's also important to stop and ask folks if they have questions along the journey and not make assumptions about what the other might understand, and even our own assumptions about what we think the patient does and does not want. To ask questions frequently, to approach with empathy, compassion, trust, try to understand where everybody on the care team is coming from. And also, I think we can, because we may not always have the privilege to keep the same patients in our clinics for decades. They may transfer to other providers. Every time we get a chance, we should educate patients and empower them to be an advocate for themselves.